Do you know your coronary calcium score? If you had a heart scan or what we call a coronary calcium scan, you would. So why should you get a heart scan? Because it helps to reveal your risk of heart disease and helps to prevent heart attacks. It only takes about 5 minutes in a CAT scan machine. This scan detects and measures calcium-containing plaque in your arteries. Plaque inside the arteries of your heart can grow and restrict blood flow to the muscles of your heart. So measuring this calcified plaque may identify heart disease before you have signs and symptoms. So remember, heart disease is a leading cause of death in the United States, and they say 40% of heart disease shows up as a heart attack. And the Centers for Disease Control state that 50% of men and 64% of women who die suddenly of heart disease have no previous symptoms. So who is this heart scan for? It's for people with low to moderate risk of heart disease, or if your heart disease risk is unclear. So a heart scan can really help motivate people at moderate risk to make important lifestyle changes, follow a treatment plan, or even get on a statin drug. So who should have a heart scan? Men over the age of 40 and women over the age of 45 with one or more of these risk factors: high blood pressure, smoking, obesity, cholesterol, diabetes, family history of heart disease. If you already had previous cardiac event or angioplasty or coronary artery bypass surgery, a heart scan is not going to benefit you. So the results give you a score that corresponds to the total area of calcium deposits and the density of the calcium. So a score of 0 means no calcium is seen in the heart and suggests a low chance of developing a heart attack in the future. But when calcium is present, the higher the score, the higher your risk of heart disease. So lastly, the benefits are that it's a very accurate screening tool available for detecting the early buildup of calcium in the arteries. And hopefully with this information, you can make better decisions about your treatment or lifestyle changes that would reduce your risk of cardiac emergencies. So if you're interested in this test, speak with your physician to see if it's the right test for you. Thanks so much.